Well, thank you. I guess we should see who is there then. Besides me, there's supposedly 13 other people.
Wow, nice.
So can I get an introduction?
So Peggy, Dave Wyndham's here. We got Scott Hilburn, Lydia, Carrie Davidson, Kathy's here from the city, Sharon Trask, Dan Stein is here, Gary Plews, Kevin Schutte, Dietrich is here, Alex is here, Randy's here, and you're here.
Yay. Okay. So can I get an approval of the agenda?
I also approve the agenda.
Second.
All those in favor or their discussion? Hello?
Aye.
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 Okay.
Aye. No discussion.
It's hard to do this over the phone. I'm sorry. Okay. And then can I get an approval of, or can I have a motion for the minutes?
So moved. Second.
Okay. Any additions or corrections? Hearing none, can I get an vote?
Aye.
All those in,
Aye.
any opposed or any abstained? Okay, moving right along. Let's have the environmental health report. Alex?
Yeah, good afternoon. I got a brief update for you all in the packets. It's been a busy past several weeks for me, so I didn't get as much details on there as I'd like to, but did get a quick summary for you there. In short, permitting activities are keeping us all very busy. Not a lot of changes since our September meeting, just more of the same. Still assisting with COVID response. The Onsite Sewage Advisory Committee did update their bylaws to reflect the county handbook. Future vacancies are going to be sent to the commissioners, if you guys remember our discussions on last meeting about that. You'll see in my packet, I've also provided a summary of our Group E water system regulations and some proposed changes. So prior to COVID, Dave and I had planned on some code updates this year. In our Title VI code, which many of our chapters in that Title VI has not been updated since the late 90s. So some of those code updates are long overdue. COVID's obviously delayed our ability to put time on this, but we're still trying to work towards those goals best we can. So with this one specifically, we had some state code changes in 2014 that prompts some updates to our code. And most of these updates I would consider kind of along the lines of maintenance to keep up with the state codes and the state program and where they've delegated authorities to. They're more of a primary point of discussion, I think, would be around the monitoring requirements around Group B water systems. Currently, our code points to the state code where monitoring requirements used to be, but no longer exist. So we kind of have a circle where we're pointing to the state and the state's pointing to us. And so there's not currently requirements in place for monitoring on these public water systems. So I think that's something we will definitely have to address as we try to update this code section. We're still working on these draft updates, so I don't have any formal recommendations or anything to you guys today, no formal actions. I just wanted to start the conversation and kind of keep you updated on what I'm trying to work on and keep moving forward. Any questions or anything?
Alex, it looked like you had a pretty good public process and a review of the regs. Who from the industry was there? Do you recall?
We do not have anybody industry related involved at this point. At some point, with code updates, it'll prompt a public hearing. And I've been talking with some of our local designers and letting them know that this is something we would like to do. So at some point, I'd be reaching out to them, some local water system designers, for some feedback on it and making sure that they're participating in our public testimony time.
Good. Great. Thank you.
Are there any other questions for Alex? I thought there was quite a bit of material there, actually. Alex, you said there wasn't much there, but it was a lot to wade through for me, not knowing water systems myself. So hopefully we will get a further update on that. Okay, Dave, are you ready?
Sure. So good afternoon, board. The first thing I have for you is a resolution, and the resolution is in your packet. I'll go through that just kind of quickly. Now, keep in mind, this resolution was written about 16 things ago, which is like Friday. So basically, we're saying that the Board of Mason County Health, the Board of Health, supports collaboration among the city, county, and businesses. We talk about we're currently experiencing a dramatic increase in cases not related to an increase in testing. Now, keep in mind, we are seeing an increase in testing, but the increase in cases are outstripping that relationship. Public health is required to address the current widespread increase. Mason County, in partnership with Area Command, are addressing the increase using non-pharmaceutical methods of social distancing, mask usage, hygiene, and dissemination of information. And this is as opposed to the vaccines. When the vaccine comes along, that will be the other piece of that. Whereas vaccines are on the horizons, timelines are unknown, many barriers remain in availability, distribution, efficacy, and uptake of vaccines, necessitating use of other interventions. Oh, I can't speak today. The governor issued mandates requiring use of masks, social distancing, and increased hygiene. Behaviors drive this disease, and a change in behavior may reduce the increase of experiencing further restrictions as a county and as a community. So we have asked, the Board of Health asked the residents of Mason County, the citizens of Shelton, to exercise greater vigilance and adherence to masking procedures, social distancing, and hygiene to prevent an increase in COVID. The Board of Health recommends that residents make greater use of the many creative solutions provided by local retailers to reduce person-to-person contact, such as curbside delivery, takeout, and drive-up services. And the board recommends that family holiday gatherings be kept small and of shorter duration, making every effort to protect those most vulnerable to the effects of COVID. The board asks that the City of Shelton and the Mason County government set the example in leadership and adherence to COVID rules and recommendations, and then effective upon adoption. So a little bit of background on the resolution. I put this together last week before the governor came out with his new regulations over the weekend. So this I don't think we really change anything. I think the piece about keeping family gatherings small, well, we're going to apply the current thing, which is keeping family gatherings to those of the household. We can make a change to that if you'd like. If not, I think it can go forward as is. So are there any questions?
David's good draft, good resolution. I appreciate that. If we approve it today, what are you going to do with the document?
So as soon as we get this approved, we'll get it out through Area Command tomorrow morning. We're having our, we have Area Command first thing in the morning, and then we have the Joint Information Center with all the PIOs. Right after that, we'll put this in their hands and let them get it out through the PIO channels.
Okay. What you're suggesting that there be a good leadership position by the city. Who's going to contact the city and discuss this and make sure they're on board?
Well, you know, we have a great city representative right here on the board.
Yes, I am. Thank you. You want me to take it?
Yeah, if you would.
I would. You want me to come over and get it tomorrow?
Yeah, we'll have, it might be tough to get the signatures, but we'll get something put together for tomorrow.
Okay, just pop me an email and let me know it's ready.
Okay, we'll do.
Thanks, Kathy. Good job.
Thank you, Scott.
I don't. How are you going to get signatures for this? Shall we just say that we approve it and you sign our names?
Yeah,
How do you want to do that?
We could do that. You know, I could say for the board and list your names.
Yeah, that might be better because it's going to be really hard to get that many signatures.
Right.
Are you still wanting me to take that over to the city tomorrow?
Yeah, we'll get this put together tomorrow morning for you, and I'll shoot you an email.
All right. Very good.
So do I,
You could
have a-
also include Jeff Knighton too.
so do I have a motion for this?
I move we approve the, go ahead.
Madam Chair, I move approval of the resolution as presented.
I second it.
Okay, any other questions? Hearing none. All those in favor?
Aye.
Aye. Any opposed or abstained? I guess it's unanimous. Okay, so do you want to say anything else about the
I've got another.
COVID report you put out just
Yeah.
today?
So I sent out the latest COVID report. That's the CDC's report on where Washington stands. So that's all in your hands. As of 11 o'clock, the governor announced that Umar Shah will be our new state Secretary of Health. And I saw him speak in Spokane, I think 2 years ago at the, I think it was at Wasac or Wasalfo or, yeah, it must have been one of those two. And he's coming to us from Harris County, Texas. So he's coming from a big county in Texas, coming up to Washington. I think he starts, I want to say the 14th of December or yeah, I think that was the 14th, is what Secretary Weisman said. So we'll have a new secretary starting here very shortly. Kathy Lovely, the state health officer, is also leaving, and we don't have a replacement announcement for her yet. So more to follow. I want to talk about the vaccine a little bit and answer questions. So we got the interim prioritization and allocation framework from Dr. Lofi this week. And it lays out the vaccine plan in 4 phases. And Wasalfo is going to be looking at this and commenting back. We have to have our comments back by the end of the week. It actually looks pretty good because we've been working on this actually now for weeks on these phases. So phase 1 essentially has high-risk workers in healthcare settings, not healthcare workers, high-risk workers in healthcare settings. So we're making a distinction because you may have people who are administrative working in healthcare settings that are also in a place where they can be easily exposed, not necessarily just healthcare workers. So we're trying to include those folks kind of in the area of operations that would be exposed. High-risk first responders, and that's 1A. 1B, people with COVID and underlying conditions that put them at significantly higher risk, people in congregate living or overcrowded settings where the majority are over 65, and then congregate settings for work such as agricultural, food processing, those sorts of things. That's phase 1. Phase 2 would include K-12 teachers, school staff, and childcare workers, more critical workers such as public health and law enforcement, people working in homeless shelters, group homes, homeless people, people with disabilities that prevent them from adopting protective measures, jails, people greater than 65 who are not covered in phase 1. Phase 3 is young adults, children, workers in industries essential to the functioning of society. And then phase 4 is everyone. So the allocations will be coming out. We anticipate that Washington in the first vaccine is probably only going to get 100,000 to 200,000 doses. And that's the 2-part dose. So really, we're really looking at in the first go around, probably just emergency room, ICU, folks that are dealing with your high comorbidity people in nursing homes. So anybody that has to turn people over, anybody who's working in aerosolized conditions like dentists will be in that first batch of folks. So that's the first round of vaccine. The rest of the vaccines we're talking about probably coming in late February or into the spring is the latest that I've heard. Dr. Stein, have you heard anything else? And
Sorry, gotta get off mute.
Yeah.
So yeah, the new there were 2 approved vaccine 2 studies that came out recently that showed the efficacy of the Pfizer and the Moderna vaccine series. Both were highly effective. I think that they're They're both 2-shot series. Pfizer was the ultra cold. Moderna's was just the frozen. And I think that all, from what I'm hearing, is that they should start to be available by mid-January or so for starting to be distributed.
Okay, questions on vaccine?
Yeah, hey, Dave, I heard that the first vaccine from Pfizer had to be kept, really down, what, minus 70 degrees or something?
Yes,
Was-
minus 80 Celsius.
Oh, my goodness. Okay. Was
I don't know.
only going to be shipped in large dosages. We couldn't go ahead and order a smaller amount for the community. It had to come in a large dosage.
So the way it's working right now is those people that, or those entities that feel that they have the capability of handling that super cold vaccine have already been asked to put in applications as primary providers for that first set of vaccine. So DOH is coordinating all that, and it sounds like it's going to be hospitals and some of the major pharmaceutical chains. So
Yeah, minus 80 is going to be really hard.
yeah, it's going to be very hard. I mean, essentially, you're going to be storing it as the same as you would store like dry ice.
Right.
And I think I don't have it in this first 9 pages, but there's another 40-some page document that it will probably also go to hotspots first. So using these phases and then overlaying hotspots on top of that.
Okay. Any other questions about vaccines?
I had a question. I don't know if Dave or Dr. Stein, if you know the answer to this, but if somebody's been exposed to COVID and they've tested positive, but they're in these high risk situations, should they still get the vaccination? Or if they've had it, do they then not get that vaccination?
I'll let Dr. Stein take that one.
I don't have a good answer to that right now. We suspect that the initial infection does carry some immunity moving forward, but we don't know how much. So I'm not sure what the recommendations will be if someone has had a previous infection. That's an excellent question, though.
Thank you.
And I will find that and get it out because that's a question I had too. So. Okay.
And how are we doing with our health officer recruitment?
Well, that is the next thing on my list. So nice segue, Peggy. Okay. So we've had some very interesting and very highly qualified people apply, but they're not MDs. So that has made it difficult. We've had some folks that have worked in Africa, working on Ebola, a very qualified epidemiologist, but they're simply not MDs. We're going to go out again, and I think, this has been working actually pretty well with Dr. Stein in a remote situation, and the way we had written up the announcement really called for more of an in-person, but I think we can rewrite that and look at doing remote work and make that work for us and maybe expand our pool. What we're finding though is we are down about 1/3 of our health officers across the state. So we have had a real series of resignations in the last month and a half. We had, I think, 1 or 2 just this last Friday, 2 the Friday before. So we're hurting for health officers across the state. Yakima, Spokane, Garfield, Okanagan, us. There's just any number. We've also had a number of directors leaving as well. So I think COVID fatigue has been certainly part of that.
It has really put a strain.
It has put a strain. And I think there's some political ends to that as well that add even more strain to some of our health officers who are having to deal with kind of both ends of the political spectrum, and it gets kind of tough sometimes. So there's going to be a lot of recruitment, and we haven't had a flood of people just saying, I really want to be in public health. So we're going to try to entice them with the ability to work remotely and work it around their schedules. So that is kind of my next step. We've advertised through NACHO, which goes nationwide, through WSALFO, through the health officers committee, through WSALFO. I have made, I don't know how many phone calls to health officers and other docs that I know that used to be health officers to try to get them to come out of retirement, and work for us. I've tried to rent health officers from other districts. So, offered to pay, 1 day a week. I'll help you out with your bill if I can have them a day a week. And I haven't had any success so far. And what I have heard is if it wasn't for COVID, they'd be glad to.
Right.
But because of COVID, the workload is so high that everybody's like, no, it's all hands on deck and we have our own, thank you. So, and I don't blame them for that. So that's kind of where we're at with the health officer search. We're going to keep working on it.
Okay.
So one thing we will have to do at our January meeting is I'll have to make contacts through the rest of this month and into December to line up who our backup health officers would be. And we have to do that every year. And you have the board vote on who our backup health officers will be. So you'll be getting that list
Right.
for the next board meeting.
Okay. Sounds good.
Dave?
Yeah.
I have a couple questions. Going back to the immunizations, you talked about a hot spot. What is that?
So for example, right now you've got Pierce County is hitting, I think, 230 some cases a day. They're considered a hot spot. King County, Thurston County is, I think they're at 130 some cases a day in Thurston County. So you've got some of these more metropolitan counties that are really having almost logarithmic increases that I would imagine that they're going to get the first shot at the vaccine. I mean, it would make sense.
Okay, then one more question too. Thank you for your answer for that. Why would we be able to use a physician's assistant under the guidance of a physician? No, you can't.
No, the way Washington law reads, it's a DO or an MD.
Okay, all right.
That has been a proposal that we've thrown through, but that would take legislation to change.
All right. Thank you.
Let's see. So that was that one. Governor's orders. Everyone has seen those. Are there any questions on the governor's? He had 16 areas that he addressed on Sunday, and then we had the travel advisory on Friday, which is a recommended travel advisory. So if you come back from out of state or somebody comes to visit you from out of state, there's a recommended 14-day quarantine. And then on the other piece, the 16 other pieces that came out Sunday, we've not gotten the documentation that comes with those. We just have the 2-pager, kind of like we did going from phase 1 to phase 2. The announcements were made, but not all the policies got there for a week or so. So we expect to see the actual policies come out with some detail. Lots and lots of phone calls. The biggest thing is the restaurants as of tomorrow will be closed indoor seating. We're currently in a situation where we have indoor gatherings in homes of just the household, no other indoor gatherings. Outdoor gatherings limited to 5. So we've had questions from clubs and organizations. Can we have our meeting with 5 people inside? Well, no, the way this is written, that's a no. So answering just a lot of questions this week. And hopefully when we get the guidance, we can get that out through the PIOs as well and get that further spread.
Okay.
Okay.
Anything?
And one last thing.
Okay.
Okay. So given that the restaurants are going to be closed for indoor seating through the middle of December, and there could even be a possibility that this goes longer, I'd like to get the board's feedback on, we generally send out the announcements for the restaurants to renew their food permits in December, with that revenue coming in around in January. So it's January cash flow and environmental health. My thought is that we can push that off to sending out the restaurant renewals in January for a February payment time, and give those restaurants a chance to get back up on their feet, get their stock redone, and not have to add that additional expense in that first month.
I think that's a great idea. I don't know.
It is.
Yeah.
Yeah.
They're already struggling.
Yep.
And commissioners, around cash flow, I think we've got the cash flow handled. I don't think there's gonna be a problem there, so.
I support that 100%.
Yeah, I do too.
Okay, commissioners, do I need to take this to a vote of the commissioners, or can we do this as a vote with the board? With the-
Since it involves money, I think it has to go to
Yeah.
the commissioners.
It's definitely a vote of the commission.
Okay, we'll do that. Yeah, I will put that together for the next briefing. And,
Okay.
and believe it or not, that's it.
Okay. So I guess we have Lydia up now.
Hello. So I sent out my report. Sorry, it was a little late and got added on. My staff's just really busy. So we had a little trouble. And then Friday, we were late still, but Friday the internet went down. So we didn't get it out till Monday. So you can read the report. I'll ask if there's any questions on that. But so today's count went out on our positive COVIDs. We're up to 683 in the county. Our 14-day rate per 100,000 is 94 cases. So we're up there, and and then our positivity rate is 145% right now. So we're high. People always ask, where are these cases taking place? It is not primarily outbreak or cluster related. It is definitely families, individual families. Sometimes there can be 3 families living in a household, but it's mostly families and just adding up that way. And then we did, a couple of weeks ago, we did a school COVID liaison training on Zoom we've asked that all of the schools would have a COVID liaison to work directly with us. One of the problems our staff is having is being overwhelmed by somebody finds out, and this can be anywhere, in a workplace or anything, there's a positive, and our staff all of a sudden gets 14 calls on one particular positive, and we just can't handle that anymore. We don't want to shut down our phones and just leave a message there, but it's getting a little crazy. And since we're at the highest we've ever been as far as daily rates, we just need people to follow different policies that we have put out there for the county and businesses to use. So for the schools, we had that training. It was very well attended. I think we had 55 attendees between whoever the COVID person was, and it was supposed to be their backup for the school as well. And so we had great attendance. We gave them lots of handouts, a couple of handouts to follow, like a flow chart, how to call, what you do when somebody, whether a child or a teacher or a staff member becomes positive. And we've given that out to all kinds of businesses. The county has it for their county employees. And we're just asking if people would use it and not just pick up a phone call. Sometimes it seems easy to just call the nurses, but we're overwhelmed. So we're asking people just follow those, the directions are clear, knowing that if there is a true positive, often we get lots of calls that people heard and they're just not accurate. If it's a true positive, we'll know about it. It may take a few days. State's a little behind, and that's going to keep happening as the cases keep going up. So it doesn't take only 12 to 16 hours anymore. It can be 2 or 3 days, but that's why we've sent out information, basically the one pager that says the 10 things of safety COVID rules is basically if everybody just follows that, people are going to be protected. The problem is a lot of people that are positive at this point have COVID weariness. And if they're asymptomatic, they don't want to stay home. They just go do what they want to do. So we are seeing that. They're seeing it all over the country, all over the state. So it's not unusual. It's not just our county in any means. But that's why we need people to just follow the simple directions of those 10 things. And that would really help our staff out trying to keep up with actually calling and dealing with when there is an exposure in a small business or an exposure at a long-term care or an exposure in a residential living situation. We can focus on that instead of people calling, asking if someone else is positive. So anyway, that's my plea and my request from my COVID team is it's getting a little crazy and we only expect it to get worse. So for the schools, they were trained and our cry and plea is read the instructions because they are pretty self-explanatory. It's just encouraging them. And then with that COVID liaison, that's why we created them, so that person can call us and we will walk them through anything they need, but would prefer not having half the school and families call us asking, is so-and-so positive? Because we just can't handle that kind of intake of calls right now. Information out, it is confidential.
Okay.
So that's basically it. Any questions with regards to numbers or anything happening with COVID? It's still, I do have about half my staff actually still working on their other programs, which is nice. But we also have hired 3 staff that are doing strictly COVID work. So we're pretty packed with work. Gary, did you have a question?
Yeah. What about demographics on the positives here in the county? Do we have any information about ages? And
it's on the daily sheet that goes out, actually. So it just went out again today. All of the demographics are on there. And so I can read you really quick, 0 to 19, and this is of all cases. So the 683, 112 are in the ages of 0 to 19. 20 to 39 age group is 248, which is our biggest group, 20 to 39. 40 to 59 is 182. 60 to 79 years of age is 116, and then 80 plus is 25. Looking at the male female breakdown, pretty even. Our 20 to 39-year-olds, it's more female than male. So does that answer your question?
Yep.
So I think you have the deaths on there also, correct? And the ages.
Yes, the deaths, we have had a request from a newspaper that we have ages, so we created a new death demographics, so it shows, because we don't want to put that on a daily when deaths go out and stuff. It can be traumatizing to family members,
Right.
et cetera. So yeah, we're keeping track of that as too. So our male seems to be higher than our female, slightly. And our age range for the deaths is 40 to 59 was 1, 60 to 79 was 5, and 80 plus is 4.
Right.
And then our long-term care is sitting the same. They actually are done with their COVID cases now, and they're reaccepting new inpatients again into the facility. It was a long 2-month trek, but
Right.
we've got it under control right now.
So I have a question.
Uh-huh.
Are the numbers going up because more people are just getting tested?
No.
Okay.
No, transmission is faster. It's
Okay.
also very interesting for us, these types of things you don't hear about, but with 683 cases, and we talked to our partners in other counties, the symptoms even seem to go in cohorts. So right now we're having cold-like symptoms, and that seems to be the newest symptoms that are prevalent. About 2 weeks ago, it was loss of taste and loss of smell, most of the cases. It changes. We're starting to see more cases that are landing in the hospital than we were in the previous months. They're getting that sick. So more intensive, even longer, where they're fine for the first week and then they get worse. So
one thing we are seeing though, in my conversation with Dr. Gushie, is we've had no flu. We've got no influenza A or B so far. So wearing masks and social distancing may help us out with the influenza and give us a little bit of a
break.
A little break on that anyway, yeah.
So
Actually, I haven't seen as many people with just plain common colds either.
We're actually seeing them because
Yeah,
people they're going for testing and they're finding out
Right.
it's not COVID, but we are seeing a lot of, there's one big one going around right now that people are pretty sick with, so they think it's COVID and they get tested and it's not.
It's not.
Another important distinguishing factor besides just the increased testing is the rate of positives, and the rate of positives is also going up. So that implies that it's not just a factor of the number of people that were testing, a higher percent of those people who are tested are coming back positive.
Right.
I think
I-
it's probably even a better identifier for community spread increasing.
I just want to say thank you on behalf of the Shelton School District for adding that case rate per 100,000. I'm sure the other schools probably appreciate that too, but since that is one of the major points that we have to look at for allowing groups, whether they're small or adding back grade bands whenever we get the chance to do that. So I really appreciate the extra effort that you put that on your report. And thank you to Dave and Dr. Stein for answering the questions that do come out from the school districts. We definitely appreciate that.
We did add that for the schools as a request, and we thought it was a great idea. So
Thank you. It's very helpful in communicating with our families the why behind some of our decisions that we have to make on that decision tree.
and then remembering, I did put on the very end of my report on the COVID-19 section, I put a picture of the graph that one of the graphs that comes from the risk assessment dashboard and the link so you can go there yourselves. There's tons of wonderful data. It will always be delayed. Our data that comes out daily is more accurate because we give you actually the date, today's data. They're about 2 weeks behind, 1 to 2 weeks behind.
Kathy, did you have a question?
Yes, I do. A real quick question about the flu season. What is usually the start date-ish for when the flu start finding the flu is starting to break out? You have a kind of a time? I mean,
Washington, our highs are in February, but it can start anytime now.
okay.
Usually starting within the next couple of weeks.
And so if somebody has flu symptoms but they think they have COVID, they go get tested. You find out that it's either flu or COVID, right?
Depending on which
So-
test you get.
Okay.
Yeah, so a lot of the work right now is moving towards if there is if we suspect that it's flu, then we test for COVID, and if it's not COVID, we treat for flu. And that's actually a general principle that a lot of providers use anyways, because the test for flu is not all that excellent. And treatment of the flu is really more important about treating early, as opposed to waiting for a test to come back. And so that's kind of the general principle is if there are some tests that are out there, including the test at Mason General that test for both COVID, flu, and the other respiratory viruses. That tends to be a lot more expensive, but it does give you a little bit of additional information.
Thank you.
Okay. Any other questions for Lydia? Okay. So, any other business or board discussion?
So Peggy, Dr. Stein's piece got left off of here, so.
Okay, I'm sorry. Dr. Stein.
That's all right. I don't have a whole lot to add besides what they've noted. I actually wasn't expecting to be able to be here. I was scheduled in clinic. So COVID has been kind of the main stuff that we're working on right now, and we're working really closely with the schools. Trying to be more of an advisory role for the school, for schools to help support them in their decisions of reopening virtual versus in-person education. I just wanted to throw out there also in terms of the schools that the governor's orders did not apply to the school recommendations or school guidelines. That the schools that were open, the governor's guidance did not recommend that they close. But in conversation with Weisman, our Secretary of Health, basically he noted that even though we're not closing schools, it's probably not the best time for schools to be progressing with further plans for reopening at this time as we're spiking cases. And so, the schools that we've been working with throughout Mason County have had excellent plans, and I've been so impressed by how the questions that they're asking and that what they're working on in order to keep all of our youth safe and hopefully get them the best education possible in the safest way possible. And so I just want to applaud all the work that the superintendents and all the school officials have been working on.
Okay, anything for Dan? Okay, hearing none, let's go on to other business. Is there anything else the board would like to discuss? None? Scott, do you have anything from the hospital you want to talk about?
You're muted, Scott.
Well, sometimes that works better too. The hospital here is just going through the same grind that everybody else is. Our staff is really working hard to stay positive and working through this, but it's getting more difficult. We're seeing some early retirements. Very difficult to go ahead and recruit new nurses into these positions. If you go out and you look for a rent-a nurse, if you will, to come in and fill in that spot, the price is ridiculous because everybody in the country, every other hospital's got the same issues. So it's very, very expensive, very challenging. We got great leadership up there. Eric's doing a great job along with Dr. Gushy, and we appreciate the link between the hospital and our county health board. Dave and Dan, you're both doing a great job and appreciate it. So thank you very much.
Okay, I guess we're on to public comment. Do we even have any public today? I don't hear any. Okay, can I get a motion to adjourn?
I just wanted to say I think this is probably my last Board of Health meeting. I really appreciate all the hard work that this board has been doing, and the support that I've received in doing my position. I would say that's not always a normal thing with a number of places around the country. And I really appreciate all the hard work and the support that you guys have been working on. So keep up the good work, and I'll be following along from afar.
And we're going to miss you.
Thank you.
Thank you, Dan.
Thanks, Dr. Stein.
Okay, can I get a motion to adjourn?
Peggy,
Yes.
let everybody have a pleasant Thanksgiving.
Thanks. Yes.
I move that we adjourn.
Here a second?
Second.
Okay, all those in favor?
Aye.
Aye.
Have a good Thanksgiving. Bye.